Hello, I'm Congressman Ted Lieu. I'm here in my Washington, D.C. office with other House Democrats in Washington, D.C., fighting on behalf of the American people. And where are House Republicans? They are on vacation. This is the fourth week that Speaker Johnson has canceled votes and is completely unacceptable in the middle of a government shutdown. We are asking for House Republicans to do their jobs, come back to Washington, D.C., and resolve this Republican shutdown. And Democrats are here fighting for lower costs and to save healthcare for the American people. I'm so honored to be joined here by three constituents, Nancy, Karen, Mario, and we're also joined by Jessica Altman, the Executive Director of Covered California. And I'd like to hear stories from folks across my district and across Southern California to know what they're experiencing, and they're going to share their stories so all of you can hear it as well. We're going to start with Nancy, whose mom also lives in my district, and Nancy is a small business owner. And if Nancy, if you could talk a little bit about your story and the healthcare issues that you're facing, that'd be terrific.
Thank you, Congressmember, and thanks for hosting this conversation. I spent most of my career with employer health insurance through the nonprofits I worked for. It was generally pretty good insurance. And about a year ago, I decided to launch my own small business consulting firm, and it's been going well, and I'm excited. But I knew I was going to lose my health insurance, and I took a look at private insurance as well as through the exchange, and realized that private insurance directly was just priced out a new small business owner. So I got an affordable plan through Covered California. I thought it was, a fair price for what I was getting. I've been receiving a subsidy over $300 a month for all of this year. And that's made it much more manageable for me. And as I mentioned to Jessica earlier, I've received the letters from Covered California saying there's changes coming. The subsidy is likely ending, but they don't know exactly how much. I've been in business less than a year, so this much uncertainty is challenging for my business and trying to figure out what I can afford for next year. Losing the tax credit itself means I've got about another $4,000 a year in expenses. And if the premiums go up as well, which I've been led to understand they are likely to, that's additional money that I'm going to have to figure out how to cover out of the startup costs for my new business. So if at the end of the day, these costs end up much higher, then I may need to decide whether or not I have to close my small business and go back to work for some kind of organization that provides employer insurance, because it just won't be financially possible to stay out on my own if I can't afford health insurance. So, my hope and plan is to keep doing what I'm doing. I love it and it's been great, but I have to have insurance.
Thank you so much, Nancy, for sharing your story. And let me explain why all this is happening. It's because the Republicans have an assault on healthcare. They have made massive cuts to Medicaid. There's a $500 billion cut scheduled for Medicare, and they have not done anything to extend the ACA tax credits. So what does this mean? It means that more than 15 million people are going to lose Medicaid. It means that Medicare is going to go down in terms of the services that it can provide. And you've got millions of people across America, including folks in my congressional district. They're going to see dramatic increases in their Affordable Care Act premium. Every situation is somewhat different, but we do know, for example, for a family of four in my district, we learned that their annual premium increase under the ACA was going to be about $12,000 annually. These are pretty significant increases that many people cannot afford. And that's why we are here in Washington, D.C., fighting on behalf of American people. And we're asking House Republicans to cancel their vacations and come back to D.C. To work on these issues. Next, we're going to hear from Mario, who is a small business owner. And Mario, if you could share your story, that'd be terrific as well.
Thank you, Congressman Lieu. Thank you, Ms. Jessica Altman, for having me here today, sharing my story. I am also, again, my name is Mario Velasco. I'm also a small business owner here born and raised in Los Angeles, California. And so my experience with Cover California has essentially been similar to Nancy's, in the sense that in my first year of business, no longer being insured by an employer, an adult in my early 30s without any type of chronic health conditions whatsoever, I was being quoted between $550 to $650 a month for basic coverage. And so that essentially was unaffordable for me at the time. And so I essentially became uninsured for about a year. And thankfully, I didn't have any medical insurance or medical emergencies during that time. Um, but I came across Cover California and then realized that there was a marketplace where I could actually obtain affordable healthcare coverage. And so I signed up, and I've been using Cover California for about 10 years now. And it was really critical for me, especially during the pandemic when my businesses were forced to shut down for a bit through the mandate and never really recovered since. But during that time without Cover California, I would have probably become uninsured at that time during a global health pandemic. And so you can only imagine, what the consequences could have potentially have been. I might not be here today, So, that's really scary when I think about it. I have associates that don't make enough or make too much to qualify for other programs, but wouldn't be able to afford what healthcare coverage is costing right now without Cover California. So, um, that's really important for me and really important for the community as a whole, because I know that if it comes down to a situation where a lot of people are becoming uninsured, it's going to raise costs for everybody. We're looking at situations where medical emergencies could lead to people losing their homes, losing everything that they've worked for, and more importantly, they could lose their lives if they're not covered. And so, that really hits home for me. And so, thank you for the opportunity to speak on behalf of the millions of people that will be affected with what the administration is currently, um, you know, doing with our healthcare and cutting our benefits with our own tax money that we contribute to. And so, I really hope that you will continue the fight for however long is needed and use every tool in your arsenal to fight for our healthcare coverage. And I appreciate again the opportunity for being here today.
Thank you so much, Mario, for sharing your story. Really appreciate it. And I just want to explain that everyone's healthcare costs are going to go up, not just those under Affordable Care Act. And why is that? Well, one reason is because President Ronald Reagan signed a law which essentially said that hospitals are not going to let people die. Uh, Basically, if you go to a hospital and you're very sick and you go to the emergency room, you're going to get treated. That is the moral thing to do. It is the right thing to do. But what happens if you don't have health insurance? What happens if you no longer have Medicaid? What happens if you can't afford the Affordable Care Act premiums and you don't have health insurance? Well, you're still going to get treated. And then that uncompensated care, those costs get passed along to everyone else who does have health insurance. And so when the Republicans assault healthcare and make drastic cuts to the Medicaid, to Medicare, and the Affordable Care Act, it ends up increasing everybody's health insurance costs. And so with that, I want to introduce our next constituent, who is Karen. And Karen is a realtor. And thank you so much, Karen, for sharing your story today.
Thank you so much for what you're doing, and thank you also, Jessica. I really appreciate it. Being a realtor, I don't know if people realize this, but we are independent contractors. We do not actually work for the brokerages. We hang our licenses there. So we are small business owners. So, our business is so commission based that one year could be awesome and the next year could be horrible. And when we have a health situation, which I had a year and a half ago, I couldn't really work very much. I discovered I had an autoimmune disease and it affected my eyesight. So I couldn't really, search for properties for clients. It was very challenging. And so it's very important for me to have affordable health care. And I'm very nervous about what is happening. I'm not quite sure what to say about it, except that, with us, if we have a good year, we really can't spend the money. We have to put it away because we just don't know. And so um, it's not like I'm having a paycheck come in, next week or next month. I just don't know. So it's very scary for me. I'm about to look for a new policy. And I'm 63, so I am going to be in 2 years having to deal with the system in even a more extreme manner. And I'm very nervous about what I'm going to be up against with that. So it's just I think it's really unfair what they're planning to do. As you know, you guys have in Congress and the Senate, you have your own medical policies, I guess, your own insurance, right? So it's a whole different thing. And I think that you're very compassionate and but it seems like the Republicans are not, they're very selfish. I hate to say that, and they need to have more compassion because their constituents also are going to suffer, not just the Democratic people that are voting for Democrats. Everybody's going to suffer, and they need to look at that. They really do.
Thank you so much, Karen, for sharing your story. And just a reminder, Republicans control the White House, the Senate, and the House. And we're asking House Republicans to come back from their vacations and work with House Democrats so we can address this healthcare crisis that the Republicans caused with their big, ugly bill and with the Republican shutdown. And it's really going to affect a lot of people, including folks in California who are on the Affordable Care Act. And so I want to now introduce Jessica Altman, the executive director of Cover California. She's been doing a fantastic job. And if you, Jessica, could respond to what you've heard and maybe let people know when they might be seeing their notices and what that means.
Yeah. Hello, everyone. It's a privilege to be with you today. I want to first and foremost thank Congressman Lieu for hosting this conversation, but for being such a champion for your constituents, for healthcare, and in particular today for those that rely on Covered California, our marketplace. And probably most importantly, I want to thank Nancy, Mario, and Karen for sharing your stories and being, brave enough to do that today in front of a lot of people. And you today are sharing your stories, but you're speaking really for the 35,000 people in Congressman Lieu's district that rely on Covered California, the nearly 2 million people across the state that are currently enrolled in Covered California, and have affordability for their health care at stake. I always like to start with, who uses Covered California and why does it matter? Covered California enrollees are hardworking Californians that simply don't have the privilege of working in a way that they have an employer who's offering them coverage, and that employer is paying a large portion of their healthcare costs. Like we've heard today, these are small business owners. In fact, nearly half of marketplace enrollees in this country are small business owners or employees of small businesses that can't offer coverage. They're also gig economy workers. They are truckers. They are hairdressers. They are farmers and farm workers. And they deserve to have affordable healthcare, just like people that work in different ways. And so when the federal government created the marketplaces with the Affordable Care Act, they said, we're really going to take that role instead of an employer paying a portion of your healthcare costs, which, by the way, is tax exempt, so a benefit from the federal government in its own way. We're going to give you a tax credit so you too can afford health insurance for the first time for a group of people, many of whom were shut out of health insurance entirely before the Affordable Care Act. What we're now staring down is these tax credits, recognizing that there were affordability challenges, were made much more generous, both providing more tax credit to the lowest income enrollees on Covered California. We're talking about someone just above Medi-Cal eligibility, maybe making $25,000 a year, but also providing tax credits for the first time to middle income enrollees, people making something like $65,000 or $70,000 a year, and saying no one should have to pay more than 8.5% of their income on their coverage. And that brought in many new people, not just to the marketplace, but to coverage from the ranks of the uninsured. Marketplace enrollment nationally more than doubled from 11 million to 24 million. And it has empowered California, along with other policies, to lower our uninsured rate more than any other state in the nation. But with that on the line, with these enhanced tax credits that are due to expire at the end of the year unless Congress acts, Covered California enrollees, what they actually pay each month with premiums going up and tax credits going down, will increase by an average of 97%, effectively doubling in cost. Now, that's an average. It will depend on your individual circumstance, but we know that will result in some people on Covered California saying, I can't afford it anymore, and I have no choice but to roll the dice and hope I don't need healthcare and go uninsured. And it will also result in people maybe like Karen, who have a condition where having health insurance is not really a choice, figuring out how to make room for that extra funds in household budgets that are already so strained. So this impact is huge. As Congressman Lieu said, it impacts all of us in different ways, and I'm sure we'll talk more about that today. But time is so critical. Yes, these expire at the end of the year technically, but people need time to enroll and explore their options and make choices. And open enrollment begins on November 1st. We have already mailed notices to our 2 million consumers that will inform them both of what their costs are based on what we know today, which is that these enhanced tax credits are expiring, and also tell people that Congress could still act to extend these tax credits and bring affordability. And so if you are one of our enrollees, if you have not received that notice, it should arrive in your mailbox any day, if not later today. So with that, Congressman, I want to thank you for having me here, helping to paint the picture of the marketplace, these enrollees, the impact to our healthcare system, and just elevating the need that everyone deserves affordable health insurance coverage in this country.
Thank you so much, Jessica. I want to ask you a question, but before I do that, I just want people to understand that Covered California is essentially the Affordable Care Act in California. So I just want people to understand that. So Jessica, you said something very interesting. You said that for employer-based healthcare, it is tax exempt, and that tax exemption is for both employers and employees. So my view is that it's only fair that for people on the Affordable Care Act, that they should also get a tax credit. If the Republicans come to their senses and actually are reasonable and restore this ACA tax credit, what happens? Do people then get a second letter saying, oh, those premium increases are sort of reversed? Or how are people going to know this?
Yeah, we will act as quickly as we possibly can to get the word out. First of all, we have a part of our website, coveredca.com, that you can visit anytime, and we're keeping live updated on what we know, what's changing, and what it means. And right now is a time, right, to be empowered by information. If you're an enrollee, that link will be in your notice, so you can go there. But as soon as we know if it happens, and we are certainly hoping and crossing our fingers that it does, that we see an extension, we will immediately work to mail new notices. We will use all of our communication channels, email, text messages. If you've said we're okay to text you, being in the media, doing town halls, if you invite me again, Congressman, to get that word out to our enrollees so that they can know that affordability is here or is back, as the case may be. And that may impact their choice of whether to have health insurance or not, their choice potentially of which health insurance plan they can have and afford. And even as Nancy talked about this, a decision about whether they really can continue to say, run their own small business and still afford health insurance, as opposed to having to look for other employment options where health insurance is provided and helped to pay for by the employer.
Thank you so much, Jessica. And I just want to note that their administration's assault on healthcare is not only to Medicaid, Medicare, and the Affordable Care Act, it's also for funding for cancer research, for a lot of research into chronic diseases, a lot of research that has helped save lives and will save lives in the future. So Democrats are fighting for all of this in terms of stopping these cuts to healthcare. And I want to thank again Jessica and Nancy and Karen, Mario for being on today. I really appreciate it. And you have done a great job in providing information to the constituents of my district, as well as to folks in California and across America who are watching this live stream and will continue to see videos of this live stream. So thank you again so much. And please, everybody, keep fighting and working hard. And we're going to make sure that we prevail on this important healthcare issue for the American people. Have a good day.